What is migraine? For your brain and body to function efficiently, nerves transmit electrical impulses to and from the spinal cord and brain. Sensors distributed across the body gather information from the environment. This data travels to the brain through a network of nerve cells. These electrical messages are passed along the length of each nerve cell through specialized routes known as ion channels. Charged particles, called ions, move through these channels, creating an electrical current. When the signal reaches the end of the nerve, it is passed on to the next cell using chemical messengers known as neurotransmitters. Communication with the brain happens through networks and control centers located in the brainstem, the part of the brain that manages essential functions like sleep, heart rhythm, and breathing. Migraine is a neurological disorder in which parts of this communication system don't function correctly. Certain segments of our DNA, called genes, determine the formation of ion channels, neurotransmitters, and other critical structures involved in this signaling process. In people with migraine, inherited genetic mutations can make the communication system overly sensitive. While most gene changes don't individually cause migraines, when combined, they can lead to a wide range of migraine symptoms and types. These genetic mutations may also impact other body systems. That's why individuals with migraines might experience conditions such as anxiety, depression, stroke, epilepsy, thyroid disorders, irritable bowel syndrome, pelvic pain, fibromyalgia, Sjogren's syndrome, and more. Migraine attacks often progress through 3 to 4 stages. These typical stages include the Prodrome, aura, headache, and Postdrome phases. The Prodrome phase begins hours or even a day before the headache, with early warning signs like fatigue, mood changes, or frequent yawning. Aura, which not everyone experiences, may involve temporary visual disturbances like flashing lights, zigzag lines, or blind spots. It can also present as numbness, dizziness, confusion, or muscle weakness. The headache phase typically brings a throbbing pain, usually on one side of the head, lasting anywhere from 4 to 72 hours. This phase may also include symptoms like nausea, sensitivity to light, sound, or smells. The final stage, the Postdrome, is often described as a migraine hangover, leaving the person feeling drained or disoriented for a day or two after the pain subsides. Migraine attacks can be triggered by various factors including emotional stress, weather shifts, irregular sleep, or certain foods. Since multiple triggers can combine to set off an episode, avoiding as many known triggers as possible may help lower the frequency of attacks. Migraines are classified based on how often they occur. Fewer than 15 headache days per month is referred to as episodic migraine, while 15 or more headache days per month qualifies as chronic migraine. About 3% of people with episodic migraines develop chronic migraines each year, potentially due to hormonal shifts or long-term brain changes from repeated attacks. While not typically life-threatening, migraine is a debilitating, invisible illness that can greatly impact quality of life. For personalized advice or treatment options, speak with a healthcare provider or visit migrainedisorders.org.